Cancer is defined by a singular, lethal obsession. A single cell aggressively divides, forming a rapidly expanding malignant cluster. For decades, the standard response to this threat has been chemotherapy. We essentially drop a biological bomb on the body, deploying highly toxic chemicals to wipe out these multiplying cells and shrink the tumor. But there is a severe catch to this scorched earth approach. The influx of toxic chemicals triggers a massive inflammatory response throughout the body, driven by a master controller known as NF-κB. This chemotherapy-induced inflammation creates a paradoxical effect. It makes the surviving cancer stem cells more aggressive and highly resistant to the exact drugs deployed to destroy them. Ending the cycle requires a strategy that outsmarts the tumor's biology, cutting off its vital resources and starving it, rather than relying solely on brute force. Researchers are finding a potent weapon in an unexpected place: cheap, off-patent lipophilic statins, the exact same daily medication taken by millions of people to manage heart disease. We need to understand how a standard pill designed to lower cholesterol in the blood manages to starve a lethal tumor of its primary fuel. To sustain their rapid multiplication, cancer cells face a massive logistical hurdle. They have to constantly construct new cell walls to enclose the daughter cells. The primary raw material required to build that structural foundation is cholesterol. To meet this enormous structural demand, the malignant cell overdrives its intake channels, pulling in vast amounts of available cholesterol from the surrounding bloodstream. The body produces cholesterol through a specific enzymatic factory node called HMG-CoA reductase. This is the exact point of intervention. Statins chemically lock into the HMG-CoA nodes, shutting them down. Without that factory producing cholesterol blocks, the cancer cell cannot build new membranes. Severing the cholesterol supply chain immediately chokes the physical proliferation required for the tumor to grow and spread. But halting the construction of new cell walls is only the first step. Lipophilic statins initiate a secondary, multi-pronged defensive against the tumor. The drugs actively reduce the number of GLUT1 glucose receptors on the cell surface, cutting off the tumor's ability to pull in sugar for energy. They also deplete the body's stores of isoprenoids, specific lipids that the cancer relies on to invade healthy tissues and metastasize. And as detailed in this text covering anti-cancer pathways, statins reactivate caspases. These are proteins that step in and program the cancer cell to commit suicide, a process known as apoptosis. This biochemical mechanism works clearly in a laboratory setting. To see if it holds up in humans, we have to look at large-scale population data. Looking at this Danish population study, researchers tracked mortality across 13 different types of cancer. They found a hazard ratio of 0.85 for statin users, meaning patients taking the drug saw a 15% reduction in overall cancer-related death. The evidence is particularly specific for prostate cancer, as outlined in this clinical report. Because cholesterol is the direct precursor to androgens, statins reduce the androgen bioavailability that prostate tumors rely on, leading to higher long-term survival rates. The biochemical logic of starving a tumor's physical supply chain translates directly into these large-scale human survival outcomes. Pioneering figures like James Watson view cancer through a metabolic lens. Instead of focusing solely on genetic mutations, they target the way a tumor physically acquires and consumes its fuel. If you only block a single metabolic pathway, the tumor acts like a highly adaptable organism. It will attempt to reroute its metabolism, using alternative pathways to synthesize fat and pull in the nutrients it needs to survive. To successfully corner the disease, statins serve as a core component of a multi-drug cocktail approach. By shutting down a specific metabolic door, they work in combination with other standard therapies to box the cancer in and prevent its escape. Because these are generic, off-patent medications, they completely bypass the billion-dollar, decades-long cycle typically required to develop and approve novel therapeutics. Advancing our treatment of cancer does not solely rely on developing exotic new chemicals. We can look inside our own medicine cabinets, utilizing the tools we already have to systematically starve the disease from the inside out.